Well, the CDC is easing masking recommendations for most Americans. The agency says that nearly 70% of the U.S. population is living in a low-risk area as cases drop in many states. However, officials say masks should still be worn in high-level areas where COVID patients are still packing hospitals. So New York will end its statewide mask indoor mandate in public schools starting on Wednesday. New York City could follow suit early next week. And in Washington, Congress will also make masks optional ahead of President Biden's State of the Union address tomorrow.
For more on this, let's bring in Dr. Celine Gounder. She's an infectious disease specialist and epidemiologist at the NYU Grossman School of Medicine and Bellevue Hospital. She's also the host of the Epidemic Podcast. Good to see you. So, Dr. Gounder, which communities will get left behind with the CDC's new masking guidance?
There are two communities I'm really concerned about. One is the immunocompromised, people who have underlying medical conditions. And a lot of Americans don't even realize they have these underlying medical conditions. About a quarter of Americans don't even have a primary care doctor, so have no way really of knowing. So that concerns me. Secondly, K through 12 schools, public schools. Just over the weekend, the education news site Chalkbeat came out with vaccination rates here in New York City, looking at the wealthiest schools and the poorest schools. And there was a twofold difference. So the highest income schools, 80% of kids had gotten at least one shot. Low-income schools, less than 40%.
Wow.
So that's really concerning because you don't have that other layer of protection in those schools.
Yeah, I've kind of been wondering about this. I know this is a sign of progress, but I'm also thinking it's cold outside. We're still sort of all caught indoors for most of our day. You know, is this the right time to do that? But I know they're looking at the infection rates. I have no idea how to figure out what the infection rate is in my community, in my work community, you know, where I live. How do you know what the infection rate is?
Well, the easy way to do this is you go to cdc.gov. At the top of the website, the very first thing you'll see is a place where you can look up your county and see if you're in one of those green, yellow, or red places. Now, I do want to note this is really about protecting hospitals. It doesn't necessarily mean you're not at risk at all, even if you're in a green area. So it's really about how underwater hospitals are, how much bed capacity they have, not your risk.
You know, it'll be interesting to see if these recommendations will change if we see the rise of another deadlier variant. And I wonder, it's sort of hard to put the genie back into the bottle. Once you now say that these mask mandates are done, which I think a lot of people I'm looking forward to not having to wear a mask, right? But on the other hand, I would want the option. No, I shouldn't say that. I can do whatever I want, but I don't think that people will abide by the government saying we're putting in another mask mandate. So how do we get people just to do it on their own volition if we see rates spiking or if we see the rise of another variant? If there's another variant, I'm going to be the first one to put on my mask. But starting next week or whenever they say I don't have to, then I won't.
Well, the CDC guidance will shift as that map shifts, right? So it's looking at day to day, what are your cases in the community? How many people are in the hospital? What's the hospital bed capacity? And that would change with a new variant. So the question is, will people abide by that guidance? I don't know. I think some will, some won't.
Yeah. So where are we, would you say, in this? Are we in the endemic stage or are we still in a pandemic?
We're still in a pandemic. So as long as you're seeing cases go up and down like that, you're in a pandemic. Endemic is really when things are much more flat, more predictable, and we're still a ways off from that.
But is it fair to say that there are certain states or population centers in the United States that are in the endemic phase?
I don't think we can even say that. Even here in New York City, where we've had a lot of infection early on, and then we have now very high vaccination rates, even here, I don't think you can say you're in the endemic phase.
Wow, interesting. So, go ahead, Emery.
No, go ahead.
I was going to say, what kind of lessons have we learned from this pandemic? It's something we've talked about before, which is President Obama and then Vice President Biden realized when we saw incidences of Ebola in New York and in some other parts of the country that we needed to have a plan in place should something like this happen. We were caught flat-footed. Are we going to be caught flat-footed for the next one?
This is what really concerns me. Public health, healthcare systems are weaker now than they were before the pandemic. You've lost a lot of staff. People are really burned out and exhausted. And what we've seen with every epidemic before this is you see a surge of attention and funding, and then it all dries up afterwards. Right. And I'm worried we're going to do the same thing all over again.
Yeah. You know, I thought to myself, there's two big issues that I don't know if we've addressed. We don't really have a structure in place to deal with a pandemic. The CDC really wasn't capable. It really wasn't what the CDC was created for. And then, as we know, this epidemic sort of shone a light on every weakness that we have in the system. And I don't think any moves have been made to correct any of those weaknesses at all. It's just been survival mode. And when we're out of survival mode, I really fear that things will just go right back to where they were before.
Just jumping off on that point, we lost Dr. Paul Farmer last week, and he had a fundamental belief that healthcare was a human right, and the reasons we found ourselves in dire straits often had to do with these issues that are underlying, and not because we don't know what to do to win the war against a pandemic. And so some of the things that you're talking about, and Dr. Gounder, you can opine on this, it has to do with the structures of our society in general in this country.
The same problems that we saw in healthcare, we see in other places, in education, in law enforcement, and now we saw them, how dire they can be when the system is put under pressure.
So Paul Farmer was a mentor of mine, and so that was really a tremendous loss to many of us in the community. One of the things he taught us about was this idea of structural violence, where you have systems of our political systems, our social systems, our economic systems that leave people behind. And as I was mentioning, those poor schools have half as many kids vaccinated as upper income schools, and that's despite New York City actually really trying to get everybody vaccinated. And so I anticipate that those disparities are even worse in other parts of the country. And I think that is what we really need to be focusing on, what Paul used to call the preferential option for the poor, really focusing on people who are being left behind.
Yeah. We need to have you on more to talk about this.
We really do, because it's a really fascinating subject. And I know from you and from others, Dr. Fauci, our own Dr. LaPook, how many medical professionals Dr. Farmer influenced. And yet we're still here. I mean, he started talking about this, 30 years ago, 40 years ago, and we're still dealing with the very same issues that he raised. Everybody said, wow, this is interesting. Never thought of that. And here we are still facing that. When I hear that kids in New York City and some of the poor districts, school districts are 40%, that's not a good number. It's not a good number. Dr. Gounder, thank you as always. Appreciate it.